Hi, I'm Dr. Seiler. We're going to do a Fraxel treatment on our patient of Asian skin here today, and she's had a couple of IPLs, and we have some deeper pigment that we want to try to take care of with this device. And we're going to do one treatment with Fraxel that will hopefully get rid of most of her pigment in her skin. She's been numbing for about an hour, and we're going to shoot this video just to show how easy it is to get through. And it's about a 10-15 minute procedure. All right, we're about to start. All right, you comfortable, Lon? All right, we're going to start right in the middle of the forehead here, okay? Here we go. All right, here we go. Feel okay? So this is a device that is a rolling technique so that it makes sure we cover the entire area here. See, she's tolerating this really well. Not hurting you too much? This is a great device for patients of darker skin, so it's stronger than IPL for pigment and for skin tightening, but not as risky as the big CO2 that I perform. You see she's tolerating this really well. This doesn't require any oral medication, which is good, so the patient can easily drive home. Let's see how fast this moves here. We actually do 8 passes with this. You comfortable? Scale of 1 to 10, how bad does it hurt?
A little bit.
Just a little bit? Not as bad as the IPL?
No.
Okay. IPL is pretty hot. This also has a cooling mechanism with it too that helps to cool the skin.
Yeah, it helps.
And that's about it. We do the whole face with this, and you can see she's tolerating it really well. Now we'll go ahead and do the other side.
Yeah, Dr. Seiler, will you tell the benefit of the Fraxel procedure?
Sure. So this procedure is kind of in between IPL and fractional CO2, 2 other devices that I use. IPL typically will just get pigment and reds and a little bit of skin resurfacing, but not really skin tightening. The big CO2 that I do is a great skin tightener, wrinkle reduction, and pigment treater, but it's got about 6 to 7 days worth of redness. So obviously not everybody can tolerate that much downtime. This procedure is kind of in between. This is something that patients usually do multiple times, 1, 2, 3, 4 times, depending on what kind of a result we're trying to get, but it does great for pigment, fine lines and wrinkles. It's great for acne scars, and one of the advantages is that in darker skin patients, that the other devices are a little bit risky. This gives them a great result without putting them at as high a risk for side effects from the stronger lasers. So, alright, turn this way for me. Alright, now we're going to get the side of her face here. You see she's tolerating this just fine. It's a little hot, but it's not too bad. She's had this, also had IPL done, like I said, and sounds like she's tolerating this better than the IPL. IPL tends to be pretty hot. Most people tolerate it pretty well. Lon's always tolerated it fine, but it does hurt a little bit, so I'm going to come back and cross-hatch this now. You can see this is a pretty easy procedure to get through. The other benefit is that this is usually only about 1 to 3 days worth of red. Usually the patient can wear makeup right away. They can drive home, obviously, because we're not using any oral medication like we do with CO2, so it's a little easier to get through afterward. You still use really good skin care afterward, which helps the healing process, and you can get that through us. Yeah, it's good for pigment, it's good for skin tightening, depending on how much you need. will depend on how many treatments. Sometimes people need 1 or 2, sometimes people need 3 or 4. We're doing this treatment much more for pigment in lawn instead of skin tightening. So since she's already had IPL, we're probably only going to have to do this once, maybe a second time in the future. All right, turn straight for me. Finish off the rest of her face here. Yeah, she's got a little scar on her lower jawline that we're going to get. Feels kind of funny when we're getting around your nose, so bear with me.
Okay.
You doing okay? Alright, so that's about it. I think we're probably going to stop filming because we're just going to do the other side, but I really wanted to show people that this is a really not too difficult of a procedure to get through, and gives you a great result, not a lot of downtime. Jill, our marketing director who's filming the procedure, has actually had it done recently, and she did just fine with it. She had about 2 days worth of little pink skin and a little bit of shedding. Do one more pass here.